Good afternoon and welcome to your 2019 professional development. I'm Jade Dabachek and I'm here. I will be going over the WIAT 3 assessment with you today. I'm going to go ahead and just jump into an overview of the assessment. So the WIAT 3, also known as the Wechsler Individual Achievement Test, is the most recent achievement test that we use and that is out currently. So, couple things to know about the WIAT 3 is that it's used in different settings. So there's a variety of settings that it can be used in. There's clinical, educational, research-based settings, which includes schools, clinics, private practices, and also residential treatments. And we do currently have psychologists throughout the district who assess some of our students at nonprofit schools, so our NPSs, who would go out and give this assessment. It's used for a wide variety of reasons, but one, because it identifies the academic strengths and weaknesses of a student. It informs decisions regarding eligibility for educational services, educational placement, and the diagnostic of a specific learning disability. The design of the WIAT is an instructional objective and with planned interventions. So overall, that's the overview of the Wechsler Individual Achievement Test, and we're going to now go through some of the background of it. So why the WIAT? Well, the WIAT psychometric information is based off of national norms. So there's a lot of information here that I'm going to review with you, but most importantly is that this assessment was nationally standardized when it was given to 3,000 students and adults, and it featured comprehensive normative information. The WIAT correlates with most of the intelligence assessments that our school psychologists give here in Saddleback, and it measures ability with the alignment of the intellectual intelligence scale. So some of the assessments that we have from the Wechsler Preschool and Primary Scale of Intelligence, which is the 3rd edition, and also our 4th edition. The study included in the WIPC was the Technical and Interpretive Manual for that assessment. The Wechsler Intelligence Scale for Children in both the 4th and 5th edition. So we have the preschool scale, but then we have from kinder up, that would be the scale for children, and that's for the intelligence test or their intellectual ability range. And then there's also the Wechsler Adult Intelligence Scale, and that's the 4th edition. We also have an assessment for nonverbal scale of ability, so our nonverbal test that we need to give, and then also differential ability scales in our 2nd edition of that. And these are all the most recent assessments for Pearson to have at this time. So they're clinical studies. So who takes the WIATs? There's 3 different professional developments going on today. There is the Woodcock-Johnson training. There is the WIAT training, which you're all at here today. And then there is also the Brigance training. So in our district, we follow, although here you're seeing the age range of individuals from ages 4, literally 4 that day, to 50 years old and 11 months can be given this assessment. In Saddleback, we like to give the Woodcock-Johnson to students that are in kinder or preschool. So we do not give this assessment to our students who are 4 years old or 5. We will, however, start using the WIAT for ages 6 and up. So from 6 all the way to grade 12. Yes, the range does say 4, but in our district, this is the model that we follow. This is used as a guide, and it's used for teams decisions. And it can be based on other factors, but if a student who we're assessing, we believe that there is a processing difficulty with a student, then this is something that we would look at, even if they weren't necessarily, let's say, qualifying for special education services. It would still be information used for the team on how to support that student and their learning. With that being said, is this an assessment we would give to anyone that we have concerns with? No, there should be other grade level diagnostics and assessments from the grade level publishers that should be used to monitor and support student learning in the classroom. So, things to do when getting ready for the test. Really important things to remember about giving the test, and especially for the little kiddos, is that they test better in the morning. We can't all have a testing block at first thing in the morning, so even if you can do, out of the 3 to 4 days that you're assessing a student, if you can get one session in the morning, it is important to see maybe giving some of the more difficult passages to that student, things that they might have more difficulty with, not necessarily difficulty on the assessment itself. It would be a great time to give that to them would be in the morning. Trying to assess for multiple days. It is not in the best interest of the child to be given an assessment in which they assess for 3 to 5 hours in one day. Statistics show that they will not do well, which is why even our state testing, we've changed it to multiple days throughout a month even to give them that assessment so that they have mornings and afternoons to do their best on a test. Making sure that we have time in our weekly or daily schedule for testing. You might not have it every day, but have it planned out that on 1 to 2 days a week that you can pull a student in the morning or in the afternoon to get that assessment done. It's also important to test without distractions. So making sure that when you're in here, just like right now, there's no one interrupting, there's no bells going off, oh, it's 5 minutes till recess. That's not a good time to pull a student for testing. They will continually ask you if it's time for them to go. Is it my recess? Is it lunch? So it's important that they get the time that they need and they don't feel rushed through the assessment. Also, the length of time definitely depends on the ability level of the students. So at times we might have students who do really, really well on some tests and it takes a really long time. We don't always know that, but we should gather that information from our own data or from the general education teacher's data, and we should know when to give an assessment and when to allow that time. So if they're doing well, that you assess them and give them the time to do it. With that being said, if a student, we're not concerned with their math skills, we're just concerned with their reading or writing skills, it is important that you give a full assessment when giving the assessment. We need to look at a wide range of ability level, and when we go through the breakdown of the assessments, I will even show you reading comprehension versus math problem solving. Even though I've had students who in the past do not demonstrate any difficulty in math, I still give all the math assessment subtests because it's important to show a family the range that when an accommodation is giving, such as reading aloud, like the math word problems, which are read aloud, that we can see how that child's understanding is and where their ability range falls. Okay, so things that are needed for the assessment. Testing material, you should have all of it ready to go when you have that kiddo in front of you. You need to be ready because they're ready. So we need the stimulus book, we need the writing scoring booklet, we need the word card, you need your pseudo decoding card, you need your audio CD, and you also need your record book and the response book. The record book is for the teacher to write in, and the response booklet is for the student to write in. So you need both of those, and when you're bringing them to an assessment, you need to have those so you can show writing samples as well. You'll also need the oral reading fluency book. It is important that we get that subscore because it's pulled together into other composite scores in which we will look at when getting a full scale score for students and student learning. Okay, so now we're going to go into the composite score summary. And the composite score summary is a bunch of different assessments that we give, in which they bring a bigger score. So our reading subtests, which we will look at, early reading skills, reading comprehension, word reading, our pseudo-decoding, and our oral reading fluency. All of those subtests together give us a total reading score. But some of those subtests, when pulled individually, will give us a basic skill or basic reading score. Why does this matter? Well, it matters when I'm looking at a student, for instance, who has dyslexia. A student who has dyslexia is sometimes able, when putting words together, able to read comprehension, do the word reading, read passages, and answer comprehension questions. But when it comes to the oral reading fluency, when they're timed, or the pseudo-decoding of breaking words apart, they might not do as well on the subtest. That's important because those scores come out and it really indicates and shows where the range of the child is, knowing where they're at and what supports they need to be successful academically, whether it's in the general education or in the special education classroom. The writing subtests include the alphabet writing fluency, the sentence composition, the essay composition, and the spelling subtest. Now, I'm going to give a little disclaimer that we do not write spelling goals. If you are, stop, because we're not doing that. In Saddleback, that is not our practice. However, why do we give the test if we don't give the goal? Because spelling is an overall part of written language, but is not the only part. So, alphabet writing fluency is for first and second and our third grade students. We do not give it to our upper grade students. Our sentence composition gives us a word that they have to build a sentence, but then it also gives us sentences that they might have to combine, like to build a compound subject, or to build a complex sentence or a compound sentence. The essay component looks at all the different pieces, but the spelling also is given so that we can correlate spelling to their pseudo-decoding and reading, because spelling will correlate. If you can decode words or if you can't, that will come up in the spelling. So why don't we write a goal for spelling? Because we're addressing the need in the reading. When we teach kids to break words apart and decode them, then they will also build their spelling ability. However, we can give supports for writing, but we will not only focus on spelling. That comes through reading. When we look at spelling patterns, we can do that in the word reading portion. The next subtest that we look at will be mathematics. In mathematics, we have math problem solving, we have numerical operations, we have math fluency for addition, subtraction, and multiplication. Now, I've in the past had students who do really, really well in the math problem solving, but do poorly on reading comprehension. And the parents will say, well, that's not fair. If you know that they have a difficulty with reading, then why are you giving them a test that they can't read? Because you need to know what your child is able, and the teacher needs to know what the child is able to do with the supports of passage read aloud and when it's not. And we will see this often with math problem solving, that when they are given the accommodation of something read aloud, they are able to do it at a grade level standard. That's really important that they get that assessment whether or not they have difficulty with math. Numerical operations then goes into just calculation. So addition, subtraction, multiplication, division, and then there are some fractions and regrouping with equations in that numerical operations portion of the subtest. Math fluency is a time test. Students are timed for 1 minute in both addition, subtraction, multiplication, not division. Multiplication is only given to students that are in third grade or higher. Our first and second grade are only given addition and subtraction. These are 1 digit by 1 digit. They are not meant to be difficult. It is supposed to be simple arithmetic that they can do fluently over the course of 1 minute. Some students will have difficulty with fluency, and that's just the rate at which they work. These subtests are important, and we should be giving them as time tests because we need to see that when a child knows they're being timed, how they perform under that pressure. These assessments correlate to the intelligence tests and some of the timed tests that the psychologists give, and it really helps us with diagnostic for students who might have other health impairments, meaning that inattention. When they're under that pressure of time, they might not perform well. And these assessments show that, and so therefore we give these assessments, and we give the assessment in the entirety of the test for each child for that reason. Finally, the last subtest that we look at is the oral language subtest. A lot of teachers don't understand why we give this test. If we have concerns with language, shouldn't we speak to our speech pathologist? No. Thank you for asking. Because sometimes we find that things come out through assessments. So it's important that we give the oral language subtest. There can be kids that were overlooked or who came to us new from other districts. Our speech pathologists do an amazing job of identifying in our preschool and our early kinder and first grade. However, we do get kiddos later on who were never assessed or who've fallen through the cracks. And I've seen this even up until 6th grade, where we have students that when given the oral language come out very, very low or poor. And I'm able to share these assessments with our speech pathologists so they can further investigate the student and their ability range or levels. So the oral language subtest look at listening comprehension, oral expression, oral reading fluency. Oral reading fluency is given as a part of a subtest for reading, but it's also pulled in to the oral language as well. So those subtests are different measures of students being timed and untimed, hearing passages and responding, what was that passage about? But it's not comprehension because it's orally read to them, and then they respond with questions of what they should interpret. If students are having difficulty with that and with their language ability, that will come out in the oral language subtest. So norms use. Some of you might not know, and it's really important that we have 2 different measures of norms to use on students. There's the age-based measure of a norm. There's also a grade-based measure of a norm. So our age-based measure is our standard form to use when assessing a student for an initial or a triennial who has not experienced retention. That is because we look at somebody within an age range and say that at that age, this is what that child has been exposed to, and therefore these are foundational skills or basic skills that that child should know. A grade-based measure is a standard form that is used for a student who has been retained. The difference in retention now is I might have a 7-year-old who is in 1st grade for the 2nd time. There might be some 7-year-olds who are in 2nd grade, depending on where their birthday falls. So a 7-year-old in 2nd grade has been exposed to more curriculum than a 7-year-old in 1st grade. So therefore, the measure and the norm that should be used off of that grade because they haven't been exposed to all the curriculum. So therefore, their scores, their standardized scores will look different because they won't be penalized for not exposed to curriculum that they shouldn't know yet. If you're not sure if a student has been retained or